There are tens of millions of people with rare genetic disorders in the United States and hundreds of millions of people with rare genetic disorders across the world. And what's so motivating is that we know that CRISPR can help many of these patients, but there's an engineering problem trying to deploy this technology in a way. And so this study is really a proof of concept. And I think what it really represents is a new paradigm in clinical medicine and effectively a new specialty within clinical medicine. I like to call it interventional genomics, but in the same way that the advent of targeted therapies in oncology led to this new paradigm of precision oncology, tools like CRISPR now for the first time enable patients with genetic diseases to be treated in a very precise and targeted way. And so that requires multidisciplinary teams to come together, like the team that came together for this study, and to have these types of multidisciplinary groups coalesce at centers of excellence all across the United States and around the world. I'm a big fan of medical history. And so the things that come to mind, this feels like maybe what a pediatric heart surgery was like in the 1940s and 50s, when people like Alfred Blalock and Helen Taussig and Robert Gross performed the first ever procedures to repair structural defects in the heart. And here what we're doing is that we are repairing defects in the genetic code, not anatomic defects in the heart or in the, let's say, the great vessels of the heart. I think what's so significant about the work that we're doing here is that it's teaching us about what needs to happen in order to scale this type of process to serve every patient who stands to benefit from this technology.